Thanks for joining us today, Terrence, and good luck with the 2021 shipping season. A new partnership between Niagara Health and McMaster Children's Hospital may work to cut down on the need to transfer patients from Niagara to Hamilton in the future. Carol Munro, clinical manager of the Children's Health Unit and Neonatal Intensive Care Unit, is here to fill us in. Welcome, Carol.
Thank you, Mike. Thanks for having me.
Well, thanks for joining us today. This is an exciting new partnership. So you're able now to have the clinicians here in Niagara speak and actually work through things with doctors up at McMaster. How is that being done?
Yes, it's very interesting. We're so happy that we can provide this care to our babies. In the past, if a physician had a concern with a baby, they would call McMaster and they would chat on the phone about what the plan of care should be. Where now we've connected with Ontario Telemedicine Network, and we really bring a computer on wheels into the baby's room. And at that time, we call McMaster. The neonatologist at McMaster can actually see the baby over the computer. So it's a great way for them to be able to assess the baby, talk with our staff, talk with our doctors, and come up with a plan of care for the baby.
One of the neat things when I read the press release was the fact that this unit can be moved anywhere in the hospital. So it doesn't necessarily have to always be used in the neonatal ICU, but it can be used anywhere.
That's right. We had to get we had to get our IT department to figure out some behind the scenes wiring, but certainly within our own unit, it can be moved wherever we need it to go. We just plug it in and we can get connected right to straight through to McMaster.
Are these cameras connected to the computer, or are they remote via Wi-Fi?
The cameras sit right on top of the computer, and then from McMaster's end, they can actually manipulate the camera so they can zoom in on the baby where we're concerned about, or they can change the lighting. They can do that from their end, so it's quite high tech.
Have you seen this in operation yet?
Yes, several times.
And what was it like for the surgeons that were involved?
From our end, we're describing a situation to the neonatologist where they can now actually see it, and they can make suggestions. They can say, move the baby this way, move the baby that way. If we're asking for some advice, they will tell us, maybe change this, change that, and we can do that right then, and they can see how well the baby's doing after that. Now, sometimes they will still recommend that the baby be transferred to McMaster. So, we certainly make that happen right away. Other times they've told us, what, you guys are doing a great job, continue with what you're doing, and we'll do another call tomorrow and see how the baby's doing tomorrow. So it's really worked very well remotely for us to have this partnership with McMaster.
This must really work to reduce the stress on parents when their baby is medically fragile at those points in time.
Yes, for sure. It's so stressful on parents, having a sick baby in the nursery, and then when they're not sure how things are going to go, it's very stressful on them. So we can certainly, we've had parents actually in the room when the calls happened. Some parents choose not to be, and then so they're involved right from the start, and we'll be updated of the plan. But I'm sure it's certainly reassuring that we've got experienced neonatologists at the other end of the line.
2 years ago, you also partnered with McMaster on the Tele resuscitation unit.
That's also another partnership we've had with McMaster with our children that came in through the emergency department. So what happens at that time, the other centers, because pediatrics just comes to St. Catharines, so the other centers now have the option of connecting right through to McMaster to their emergency department and talk to one of their emergency physicians. So once again, it's a great way for the specialists at to McMaster to see a child that may be in Port Coburn or Fort Erie or Welland, that they can have a look right at that child and say, what, that child should come directly to us, or what, you guys are doing good, send the child to St. Catharines and we can manage the problem here.
Do you look forward to more collaborations with McMaster Children's Hospital in the future?
Yes, we have a great relationship with them, and we certainly appreciate all that they do for us. We work very closely with them. Our children go back and forth, and babies go back and forth as needed. And yes, it's a great relationship we have.